Thanks for tuning in to this special telemedicine edition of the Data Point podcast. This episode is one of several leading up to the annual meeting of the American Telemedicine Association in New Orleans, Louisiana on April 14th through 16th. Check out the conference. I think you're going to want to be there. And if you don't believe me, these next several episodes are going to try and prove it to you. Almost 15 years ago, a social innovation team at an organization called Hopelab launched a video game called Remission. It was like most video games in that it was targeted at adolescents, but it was unlike most video games in that it was targeted specifically at adolescents who were recovering from cancer. What's really interesting is that it completely changed the game in terms of the way that we interact with kids around their health. That game proved time after time to promote consistent treatment adherence, a faster increase in their rate of cancer knowledge, and an increase in their self-efficacy and agency as empowered patients. 15 years later, Hopelab is still going strong. Hello and welcome to a special edition of Data Point, the podcast that's all about how data and analytics are driving innovation in healthcare. We're focused in this special edition on telemedicine, leading up to the American Telemedicine Association's annual meeting in New Orleans, April 14 through 16. Our guest today is going to be one of the plenary speakers at that conference. Her name is Margaret Laws, and she's the CEO of Hopelab. Margaret has a long history of developing innovative ways to deliver healthcare to underserved populations. And you're going to love learning about some of the work that she's doing today. Margaret, thanks so much for being with us on Data Point today.
Thanks for having me. Looking forward to the conversation.
As am I. As you know, I've been a fan of Hopelab for many years, and we'll talk a little bit about that. But before we dive into the work that you're doing today, I'd love to give our listeners a little bit of perspective on how you came to be the CEO of Hopelab. Can you sketch in a little background for us so we have that context?
Sure, happy to. So I've been at Hopelab now for about 3.5 years. And prior to that, I spent almost 2 decades at the California Healthcare Foundation in a range of different positions. So I started out at the very beginning of the foundation in the late 90s. And I was the director of health policy. About 2006, I started a program there called Innovations for the Underserved. And that program was focused on bringing innovations in healthcare services and technology, some areas where I had prior experience, to underserved populations in healthcare. So in that Innovations for the Underserved program, we worked with community health centers, with hospitals, with healthcare organizations all around California, really looking at how digital tools could improve access to care and reduce cost of care. About 2010, also at California Healthcare Foundation, I started the CHCF Health Innovation Fund, which is a social venture fund, a social innovation fund designed to invest in companies to bring them into the healthcare safety net. So in the CHCF Health Innovation Fund, we did, and the fund continues to invest in digital health companies, some of which are telehealth companies, with the specific purpose of bringing those innovations into the healthcare safety net in California and around the country. So there, we've made in that fund, I think now about 15 investments. My colleague Melissa Buckley took over on my departure. And many of those investments have exposed us to remote care and digital care in a number of ways. But throughout that time working in Innovations for the Underserved, I personally spent a lot of time working on telehealth. So I probably started my work in telehealth in the early 2000s. A lot of the work at that time was focused on trying to improve access to care for people in remote and rural areas in the state of California, and access to specialty care throughout the state, where underserved populations have, as I think most people know, historically had a difficult time getting access to care.
Yeah. And it's really interesting because we obviously met through the context of telemedicine or telehealth. We're both going to be speaking at the upcoming American Telemedicine Association annual meeting in New Orleans. But what's really interesting is that The work that you're doing today at Hopelab doesn't sound very much like traditional telemedicine. Can you help us understand a little bit about how you feel that term has evolved and where it's headed?
Really an interesting topic. And when we started working in telehealth and telemedicine, the application of at least a sort of consumer-facing digital technology was really new. When we think about, fast forward 15 years to today, and especially when we talk about young people, and Hopelab has a focus on working with teens and young adults, these are people who have grown up with technology really as a completely interwoven part of their lives. And so when we think about what telehealth means and what bringing the sort of tele to the context of a healthcare interaction means, or a health interaction today, I do think we've expanded and we think very differently about it. So when I think about the way young people receive healthcare or interact around health issues, the likelihood that they might do something interactive is very, very high. If they think about, particularly about the way they want to interact or receive care, the likelihood of a young people wanting or expecting that to be like the other things in their lives, where they're mediated by some sort of a digital tool or app, is very high. And so when I think about young people and the potential for sort of, quote, telehealth, I do tend to think more broadly about the application of digital tools to the kinds of interactions that we need to have with young people, or that young people need and want to have around their health.
It's interesting, just to paint the picture, obviously healthcare as we know it has been provided in very much the same way for a long time, which says that, when you are in need of healthcare, you get in your car and you drive to a facility where that care is provided. And I know initially that a lot of the focus around telemedicine was, well, let's at least take the car out of the picture and, give people the ability to do a more virtual interaction with a healthcare professional. But what you're talking about goes well beyond just the virtual visit, doesn't it?
It does, and I think that's actually a great way to think about it, is that when we first started talking about telehealth, at least in my career in healthcare, it was really about video visits or virtual visits. So it was about two people on either side of a often very slow and very expensive and prone to freezing connection.
Right.
And now we think really about a whole, texting, a whole range of different technologies that have been used to actually support people or deliver care, depending on how you define it. And so when we think very, very broadly about it, when we think about it as applied to young people, and even just, in my personal career in healthcare, we have been shying away from talking about this is technology in healthcare or this is telehealth, because technology as a way of interacting with the world has become such a ubiquitous force, and we've really begun to experience life mediated through technology in a very different way. And so, when I think about the word telehealth and I think about this conversation that we're going to be having at the American Telehealth Association, I'm hoping that it becomes kind of a much broader, richer discussion about the way we use digital tools and the much cheaper, more ubiquitous, more accessible ways of interacting as we think about how we can improve healthcare, how we can be more focused on what consumers or people really need out of the healthcare system.
But when we talk about that, you referenced a survey that you'd done through Hopelab to better understand how teens think about health and healthcare, and I guess to some extent the world around them. Can you tell us a little bit about that survey and what some of the things are that you learned that would differentiate the teens' experience from, say, yours or mine?
Sure. We conducted the survey and released it almost about a year ago. It was a national survey of 14 to 22-year-olds. And so we were really trying to look at this teen young adult audience that is Hopelab's primary focus. And we interviewed young people across the country, rural and urban, across that age group, balanced for race, ethnicity. And we got really interesting and not surprising results, but I think results that can really help us think about how we more effectively deliver care and access to young people. So to give you a couple of examples, in that national survey, 87% had gone online for health information. 64% had used mobile apps related to health. 61% had read or watched someone else's health story online. This is a big theme with young people. I think this notion of peer support and using these tools to connect with peers and learn from others was a big theme throughout the survey.
Interesting.
Almost 40% had looked for people with similar issues or concerns online. And this is the last year, about 20% of the young people we surveyed had actually connected with health providers online. So one of the really interesting things we were trying to do, because a big focus for Hopelab is mental and emotional health and well-being of young people, is we looked at the extent to which young people with moderate to severe depressive symptoms use online resources. And we found that those numbers were really significant. 90% of those young people had gone online for mental health information. More than 75% had used mobile apps related to health. More than 75% had read or watched someone else's health story, looked for people with similar concerns, more than 50%. And 32% of those young people had connected to health providers online. So I think one of the themes that is emerging, and we can talk some more about, is the extent to which mental and emotional health issues and support needs are being increasingly met through online mediation or through online resources. Certainly something I saw a big demand for and continue to see a big demand for at working in telehealth over the past 15 years, that the ability for people who are having mental and emotional issues or support needs to be able to access resources online is a huge need, and it's
Absolutely.
a need that we only see growing.
Well, that is a fascinating subject, and I think we are going to pick that up when we return from our break. We're going to be right back with Margaret Laws, the CEO of Hopelab, so stick around.
Today's show is brought to you by Bluespire, a full-service digital marketing agency focused on complex and highly regulated industries of healthcare, senior living, and financial services. Rapid changes in the healthcare industry are causing consumers to seek out trusted advice, demand more transparency and access to information and content. With over 30 years of healthcare experience, Bluespire knows how to help you reach, communicate with, and gain trust from these consumers. We help you engage with the right content at every touch point, from the first symptom search to appointment scheduling through care management. Visit us at bluespiremarketing.com to learn how we can help you deliver relevant, engaging content through ever-changing touch points that matter.
All right, we're back. You're listening to Data Point. I'm your host, Greg Matthews, and we're here today with Margaret Laws, the CEO of Hopelab. Margaret, we were just talking before the break about the teen technology survey that you published the results of last year. I'm really curious, having gained some of those insights about how teens are interacting with health and where technology fits into that, how has that impacted some of the work that you're doing today at Hopelab?
But that's a great lead-in for a lot of discussion about the work we've been doing in mental and emotional well-being. I also want to highlight a couple of the other projects and programs we've been working on. So Hopelab's genesis, Hopelab's first project was in building a game for young people with cancer. The goal of it was to actually improve adherence and compliance to their therapies, to their drug regimen, but also to try to help boost agency and kind of self-efficacy of young people as a way to help get them to have health outcomes that were as positive as possible. So Hopelab has a history working with young people with cancer, and we do have one big project going on now that focuses on that population. So we have one project that is focused on helping young people, teens and young adults, in the 2 years of survivorship immediately post-cancer treatment. This is a year of really well-documented poor outcomes for young people, lots of distress, anxiety, depression. And we set out in the method that Hopelab uses, working very closely with young people as co-designers and leveraging research in psychology and kind of the neuroscience of young people's brains to try to work with young people on some sort of an intervention that could help alleviate this distress, this anxiety and depression. And in that project, as in all of Hopelab's projects, we really think about how technology can be an enabler of the solution and how using technology as a way to get young people engaged, it can be brought to bear. So in that project, we work with young people to build what is a chatbot, actually a chatbot called Vivibot. And it's a chatbot that delivers to help young people boost resilience, boost self-efficacy as they are in this period of difficulty post-cancer treatment. And interestingly there is not a person on the other end of the line. So if you think about it from a traditional telehealth perspective, what we heard from young people was not, I want or need to talk to a therapist. Now, many of them do, and hopefully many of them get that treatment, but many don't. And what we heard from a lot of young people was that they want something that is like a person, but isn't a person. That for young people for a young person in that situation, the interactions and the reactions that they have with their loved ones and with the people who are trying to support and help them can be challenging. They feel like their family's worried about them. They feel like they're unloading. Nobody wants to bear the burden. They don't feel like they feel like people will worry about them if they talk about feeling low. And so the idea of being able to interact with a bot that can be delivering support in a non-judgmental way has been a really important insight and a really important feature that we have built into this intervention, Vivibot. So, when we talk about telehealth, is Vivibot, is a chatbot that interacts with you to help provide support and help you improve your health outcomes, telehealth, maybe not in the way that we've talked about it historically, but I do think that in this situation, the ability to apply technology and to deliver a evidence-based intervention through the technology is something that is a really interesting place where young people can be sort of the trailblazers or the standard bearers into new ways of receiving care. And think about, the peer support or non-professional support being something that helps improve access.
And honestly, I think that that's a great example of how co-designing with your target audience can highlight insights that you might not necessarily have found intuitively, one of which is the fact that having a non-human partner in this process, in some ways for the teens, is actually better than having a human partner, because they don't have to worry about the emotional burden on that partner, whether it's a family member or a clinician, and they don't have to worry about posing or making somebody feel that they're doing better than they really are. What a fascinating insight.
Yeah, no, very well put. And I think that the important point that I want to make now, because it applies across all the work that we do, is none of this is to replace humans, right? At Hopelab, one of the things that is really, really important to us is the power of human connection and of human touch. And a lot of what we try to build into and think about and learn from young people about is how important human connection is. And so when I talk about technology as an enabler, I do think it is an enabler to human connection in many cases. In this case, to your point, this is one where it's interesting to think about how we can use technology for this role in a way that for these young people at this particular moment in time is a good alternative to what would otherwise be a human interaction.
Absolutely. And it's such a great thread going back. You talked about the fact that remission, was designed to enhance adherence to treatment, but also to build agency and self-efficacy of kids with cancer. And when you think about that game, it was clearly never designed to be a replacement for the oncologist or the interactions with the care team, at the institution where they're seeking care. But there's no question that was a really, really creative use of technology to actually enhance the results that were achieved. And it sounds as though the Vivibot program falls into that same mold. It's not a replacement of an interaction with a human or a replacement of a traditional care setting, but it's an augmentation that provides incremental value that wouldn't have been possible otherwise.
So one of the other projects we're working on is with Nurse Family Partnership, a really terrific organization, a national nonprofit that works with first-time, high-risk young moms, many of whom are teenagers, a lot of others who are not teenagers or young adults. And again, these are all young women who have grown up as digital natives and are very actively using technology in other aspects of their life. Mm-hmm. And Nurse Family Partnerships program, which is really a program that's deeply based on human connection. It pairs a nurse with this young mom. The nurse visits with her in her home from before 28 weeks of pregnancy till the baby's 2, and really works with her on a whole range of health and life skills for her and the baby. And what was interesting about this program is that it's about 40 plus years old, has, really terrific efficacy studies, randomized controlled trials, many accolades throughout the years. But what they were hoping to do, and what we were hoping to do with them, is to make the program more relevant to, more resonant with this young digital native mom, and also to use technology to think about how to make it more scalable and more flexible for the mom and the nurse. And so when you think about the ability to have touch or to have connection, once the mom and the nurse are connected with the program materials and to each other, just something simple like the nurse being able to send shout outs to the mom, the nurse being able to have connections with the mom and send her something to read or an activity to do in between visits. Again, does not replace the mom and the nurse meeting with one another, but it really leverages the technology to have a deeper and more frequent connection. And, if you think about it in the terminology we use in healthcare, to really improve that young mom's access to support and care in the system.
Now, is that something that you would say the participants, the young mothers in the program, find surprising, or is that something that they just consider a normal part of the way that you interact with the people in your life?
Yeah. Well, one of the really fun things about this project and this work that Hopelab has done is that we have a team of designers, human-centered design experts, and we spent a lot of time out in the field, in people's homes, in the homes of the moms, out with the nurses, understanding how the nurses relate to technology. They're a little bit older than the moms, so some of them love it and use it in every aspect of their life, and others were not so excited about it.
I'll bet.
And then for the moms, it really was just normal. These are moms, and they're low-income young moms, but they are all on smartphones, and they're dealing with other aspects of their life using their phone. And so for them, it was a very normal way of interacting, and it was something that they had, were expecting. If you want me to read an article, or if you have something for me to do, could you send it to me? And now they can. I know that sounds crazy, but it is, remember, many young people have been, FaceTiming since they were very, very young. And so the idea of picking up a phone and having a conversation with someone where you are actually viewing one another isn't as scary or complicated a thing as it is for many older people still today. So
it is great to see that intermingling of a technology solution with a program that, as you said, for more than 40 years has been based on an in-person interaction. Any thoughts as to what kind of outcomes they're seeing, or is it too soon to tell in terms of the measurement of the success of the program?
Well, that program is currently in a 5-site randomized controlled trial. So we've got sites in Minnesota, Alabama, the Bronx, upstate New York, and Contra Costa County in California. And that trial will be finished at the end of March. So we'll have some information about that by the time we get to probably not by the time we get to the conference, but not too long after. But I will say what has been really interesting about it is that the relevance of being able to interact using digital tools is something that really is important to the organization and to this whole sector going forward. To be able, to your earlier point, use all the tools you have available to be able to reach your patients, people, customers you're working with.
Love it. I know we only have a couple of minutes left in the podcast, but I wanted to ask you about one final program that we had discussed before we got our interview going, and it relates to mental health programming specifically targeted at college students. Is there a quick overview that you could give us there? Because I know it's one that will probably be of great interest to a lot of our listeners.
Yeah, it has been the area of teen mental and emotional health and well-being really has almost become an umbrella over everything we work with. As we kind of have looked at where we think the work of Hopelab can have the most impact on young people, and frankly, where trends in the health and well-being of young people are not great, mental and emotional well-being is a really important one. And so we are going to be doing a range of projects in that area, but the first one focuses on college students. And what we were looking at there was the problem of increasing loneliness, anxiety, depression, and even suicide among college students, and thinking about how we could bring the tools of Hopelab to bear to try to work on that problem. And so one of the areas that we have dug into as one of our first projects is looking at loneliness in college students, really significant statistics, which are broadly in the news, about the number of college students who say they are lonely or disconnected. Mm-hmm. And so what we've been working on is a project with a Denver-based company called Grit Digital Health that has a platform called You at College that delivers virtual services and kind of connects young people in colleges to the resources on their campus. We've been working with them on a digital tool that kind of connects the digital and the in-person and helps young people learn to take social risks and make social connection. So really looking at how do we use the tools that young people are really attached to, their phones, their social media sites, their online world, to get them to actually interact in the real world in a more effective way, and to try to mitigate some of this loneliness and feeling of isolation by helping them use the natural teenage tendency towards taking risks to actually take positive social risks rather than just some of the negative risks that we think about with young people. And so that's something that we'll be getting out into pilot testing on campuses this fall. But to your earlier point, it opens up, I think, a really interesting door to where I think telehealth for young people, in the immediate future can have some of its biggest impact, and that is in every form, everything from a virtual visit to peer support to even kind of texting and positive psychology and cognitive behavioral therapy apps to really help support young people in what we're really seeing as a significant time of challenge around young people at college age and high school age, feeling like they don't have the mental health and kind of emotional support that they need. So I think a booming area for many people who are working in telehealth, and one where I think we can really help young people in this country if we apply these tools as effectively as we can.
I am really excited to hear that, and I can tell you, as the parent of two teenagers, my anecdotal experience tells me that you are dead on in terms of the potential value that can be created there. Margaret, I'm so grateful to you for spending this time with us. I am really looking forward to seeing the plenary session that you're going to be leading at the American Telemedicine Association. And for our listeners, if you are interested in finding more about Margaret and her work, where can they go to learn more about Hopelab?
Yeah, please visit our site. We're hopelab.org. And there's lots more information about the projects that I've talked about and some of the other work they do, including the research that we support around the kind of psychology and health potential for bringing digital solutions to bear with young people.
Fantastic. Well, I'll also encourage our listeners to connect with Margaret on Twitter. I know that you are Margaret Laws on Twitter. I have followed you myself. And thanks so much for being here.
Terrific, and thanks. And Hopelab also on social media. You can find us on Instagram, Twitter, Facebook, LinkedIn. So please reach out and connect if you're interested in learning more about our work. And Greg, thanks so much. It's been a terrific conversation, and I look forward to continuing it at the ATA session.
Sounds great. Thanks so much for listening to the Data Point Podcast. If you like what you've heard, please do rate, review, and share it with your social network. It means a lot. And if you have ideas for show topics or guests, please email them to me at greg@healthquant.health or send a direct message to @ChiMoose on Twitter. That's CHIMOOSE on Twitter. For more information about this show or any of the terrific healthcare podcasts in the Touchpoint Media Network, check them out at touchpoint.health. See you next time.
This has been a Touchpoint Media production. To learn more about this show and others like it, please visit us online at touchpoint.health.